Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and today we're going to talk about the virtual dental assistant. What is that? And I'm going to tell you a little bit more because I've worked with virtual dental assistants before. I kind of created the whole virtual dental assistant. I think I did. Because I started using them way before it was even a thing. So try Googling it. It's a little tricky. I went to Glassdoor, I went to Indeed, I went to LinkedIn, and there were a few listings for virtual dental assistants. The vast majority were more front office, and it was like billing stuff, which I wouldn't really call dental assistants. It's a front office or office manager responsibility. When I'm talking about virtual dental assistant, I'm talking about back office, working directly with patients, treatment planning, virtual check-ins on procedures, virtual post-op checks, virtual retention checks, virtual aligner checks, virtual phase 1 appliances checks. There's so many things you can do, like actual dentistry. So now, in terms of the training for a virtual dental assistant, you need to read your own Dental Practice Act. There's definitely some states where you can have anyone doing this. There's definitely some states where you might have to be an ortho RDA. So I'm not telling you what they need because that's your job to figure that out. Every state is different. Every country is different. What I'm explaining to you is that this is something that dental assistants want. They want quality of life. They want flexibility. They want flex time. They do not want to be in your office for how little they get paid. And I know you think you're paying them well, but you're really not. They want the ability to make additional money if they do really good work. They want ability to work maybe flex time, maybe work in the evenings, work on the weekends when they have free time to make additional revenue, or work less in the office and more at home if they've got kids. And that's what the virtual dental assistant is for. If you are growing the removable practice component for ortho, be it Invisalign, ClearCorrect, clear aligners, phase 1 appliances, it can even be sleep appliances, retention checks. There's so many things you can do that are removable. There's no reason a patient needs to come into the office unless there's a problem. And there are many, many ortho offices out there that do not give follow-up appointments. You come in, you get your Invisalign, you get your clear aligners, you get your appliance, you get your Schwartz, you get your retainer, and then you're not coming back in the office for a very long time, if at all. And someone is going to be checking in through a HIPAA compliant app to make sure things are going well. Regular appointments, whether they do synchronous or asynchronous. So asynchronous means you're gonna use an app. There's a lot of apps that are out there. The one that I prefer is called InHand Dental. It's kind of like dental monitoring system where there's a dashboard, it's HIPAA compliant. Patient logs in through an app, doctor logs in through an app, and they are going to get a series of selfie pictures to check in on their aligners, with their aligners in, with their aligners out, with their old aligner, with their new aligner, to make sure things are tracking, to make sure the bite is even, maybe to check their elastic wear. You can even have virtual dental assistance responsibilities for braces patients, but occasionally they're going to have to come in, even more so if you're doing fixed ligation, if you're using the snap down, the Damon kind of braces, because you really don't need to come in those situations because there's no rubber to degrade. So an appointment isn't needed unless you need to change the wire or change the mechanics, right? So it's very, very easy for a virtual dental assistant to capture that data and if escalate it to the doctor as needed, but to communicate with the patient. Synchronous is better because then you can chart it as an actual visit. Asynchronous means that we're using an app, getting selfie pictures, and they're being reviewed. And then communicating back to the patient the feedback and looping the doctor in as needed and charting in the chart. Now, whether you can actually bill for this visit is probably less likely. So I'm assuming this is either a cash patient or, the patient is sometimes coming in the office and the treatment is going on, but just all kind of things to consider. You can definitely do this. Assistants definitely want this. As for how they get paid, that's really up to you, how you regulate it. But it definitely is something that could be done with the actual, especially another thing that you have to keep in mind is you can do virtual consults, which is virtual new patient visits for emergencies or anything else could be done totally through a virtual dental assistant, synchronously or asynchronously. And dental assistant could easily be at home. Obviously, you want to provide them the hardware for that so that you keep it HIPAA compliant and it has everything it needs. You cannot assume, I would not be letting a dental assistant use their own phone or their own computer. That is a huge, huge, huge mistake and a huge HIPAA violation because I'm sure they're not set up properly for that. But what an amazing thing. I know in our own office, we have an office manager that has to go on leave for a few months to take care of an ailing parent who's having some type of medical procedure done and they need to stay home with them. It's too expensive for them to hire a home caregiver. So I know my husband, for example, is letting her work at home and do virtual visits and things like that and virtual treatment planning. So, for example, it's definitely doable, and it's something people want, and it helps people to keep their jobs during things that are going on with, kids or with family members. And it helps you really to keep the culture in your office and make things more flexible for those people who are looking for that. So keep that in mind as you, consider your job roles and responsibilities, and consider having a virtual dental assistant, either part-time or full-time. All right, thanks.